Please like, share and subscribe to Edentophagia. Bad breath. Let's talk about bad breath today. This is something which many people suffer from, but they often neglect it and they do not want to talk about it. And there are sometimes family and friends which don't let them know that they are suffering from it. Let's demystify bad breath today. Why is it caused? How it is caused? What are its repercussions? What are the home remedies around it? And how and when should you go to a dentist? Bad breath is a sign that there is something wrong in your system. In your oral cavity, there is either some growth of bacteria. There are several causes which I'm going to discuss. Bad breath is an indication that there is something which we need to rule out. So it's an indication, it's a sign by the body which we need to put our attention into. Bad breath can lead to low self-esteem, anxiety in patients. They don't want to meet people when they have bad breath. They're very conscious about talking. They don't smile much. It's a kind of social thing also where people hesitate in talking and interacting a lot. It becomes embarrassing for some people because they know that they have had a bad breath. It's just a body's symptom to tell us that there is something wrong either in the oral cavity or in our system and we need to take care of it. And because of all these reasons which I said, stores have n number of mints and oral rinses which are available over the counter which you can have, but these are all temporary solutions. Nothing goes to the problem, the root of the problem, where we can go and actually solve the cause and stop the bad breath from coming. So having mints or chewing gums or oral rinses, these are very temporary solutions to it. We have to understand where we are going wrong and why is this bad breath happening at the first place, and we have to stop it at that level. And that now let's get into the causes of bad breath. The first cause I want to tell you is bad breath can be caused due to consumption of tobacco products. Like smokers have a typical kind of smell to their breath. People who consume chewable tobacco also have a typical kind of smell in their breath. So that's one reason of bad breath. One more reason of bad breath is consumption of certain kinds of food like garlic, onion. When you consume these, not even your mouth smells while you are having that food, but also when these foods get digested, the substances travel through blood to the lungs, and then also your breath can have a little bit of bad breath around it. So the third thing which I have been talking almost on my every video is poor oral hygiene. If you are not cleaning your tongue properly, if you are not brushing your teeth properly, people who wear dentures, if they're not cleaning their dentures properly and then there is food accumulation there and then the bacteria, they work around it, that is when bad breath happens. What happens is bacteria, when it eats on the food substance, it also releases sulfur gas as a byproduct, and which is obviously, we all know that sulfur gas's odor is something which is not good. Fourth reason is low saliva or lack of saliva. We call this condition as xerostomia, in which the saliva production by the oral cavity and salivary glands becomes very less or almost nil. What happens is saliva acts as a natural cleanser to our oral cavity. What saliva does is it flushes away all the extra food which is present in our oral cavity. So when there is less saliva, this flushing doesn't happen. So what happens is the food and bacteria, everything is happening in that area and there's nothing which is flushing off the things. This is the main reason why we have morning odor, because when we sleep, body automatically knows that you're not eating anything, you are in a peaceful sleep mode. So body's saliva production lowers down. So whenever you open your mouth in the morning, there'll be some odor in your mouth. This is more prevalent when people who have this habit of sleeping with their mouth open. What it does is it makes the mouth all the more dry. So there is not even a little bit of saliva which is present, and it can also cause bad odor. Consumption of certain medications also causes bad odor. Either the medications, they reduce the saliva production, or the medications, when they get assimilated and absorbed by the body, they get it via lungs. What happens is the breath becomes a little smelly. Now next, infections in mouth can cause bad breath. Like if you have had a recent tooth extraction and you're not opening your mouth or not cleaning your mouth very properly, or if there is a gum disease in your mouth, or if there is a abscess which is present in your mouth, these all are the things where bacteria are there, and these are the things where pus production happens. There's a lot of degradation which is happening. So these things cause a little bit of smell, and when you open your mouth and you try to talk, these come out as a bad odor from your mouth, which is bad breath. Sometimes oral, nasal and throat infections also cause bad breath. When you have tonsils and there are bacteria on that tonsils, sometimes there's a bad breath because of tonsillar infections also. Or when you have chronic nasal infection, when you have chronic nasal blockage and you have post-nasal drip, that's when you feel there's some cough which is constantly dripping through your throat, and that's a chronic condition. That is when, because all these substances are lying in our way of breath coming and going inside, they can also cause a bad breath. Other causes of bad breath are certain metabolic diseases, oral cancers. Yes, oral cancers also have a typical bad breath. So, and gastric esophageal reflux disease, which is called GERD, which is, in common terms I'll tell you, which is a common acidity problem when people have a lot of acidity and they have regurgitation all throughout they have acidic substance coming through their throat all throughout the day. That is when they also have a typical kind of smell from their mouth. So you see, there are so many reasons of having a bad breath. We need to rule down. And for every reason, body is trying to tell you that there's something wrong. Either you have a bad habit, you're not following proper hygiene, or you're consuming some medication, or your saliva production is less, or probably you have a nose or throat infection, or you have something inside your mouth or metabolic disease. It's body's sign of telling you that there's something where we are going wrong, where we're not taking correct care of our body, and we should pay attention to it. Never take things lightly. It's not a point of embarrassment. We should always go ahead and ask for help. Coming to the treatments and remedies, there are certain things which you should do at home before you go and visit your dentist, and if those things don't work out, then you have to go and visit your dentist. The things which you could do at your home is, it's a lifestyle change. For people who are not very good with oral hygiene, or who are not very regular with all the things of oral hygiene, it's a lifestyle change for them. You need to brush and clean your mouth twice daily for 2 minutes using correct brushing technique and toothbrush and toothpaste. Okay? You need to clean your tongue. There's no alternative to cleaning your tongue. You should scrape your tongue daily. You should floss so that there's no food residue in between your teeth. Flossing is very necessary. You should use a good oral rinse, antimicrobial oral rinse, which will reduce the bacterial count in your mouth and which will aid in reducing the bad breath which is coming from your mouth. And last thing which people usually neglect is drinking lots of water. You should have plenty of water through the day. When you keep drinking water, what's happening is the pH of the mouth is getting balanced. Residues in the mouth are getting inside. And when water flows through the system, it automatically detoxifies your whole body. So toxins are released via all the excretions which we do. So drink lots of water. And even after following all these things for 15 to 20 days, if you think that your bad breath is not getting into place or it's not getting corrected, you should see a dentist. They will see if there is any underlying cause related to teeth and oral cavity, and they look at it if there's any abscess, any gum disease, any cavity, or whether there is a lot of plaque and tartar, or whether saliva production is less, or are there any ulcers in your mouth, or is there any chance of oral cancer or any other oral symptom which might be a reason, or is there any tonsillar infection which might be a reason for the bad breath, and they'll try to rule out. If they are not able to rule out and there's not something which is present in your oral cavity, then they'll refer you to a physician. And a physician can look at other things, which can be any metabolic disease or any other thing which you have because of which you're having bad breath. Is there any nasal infection, sinus infection, anything? And they'll let you know, and this can be cured. Do not treat it as something which cannot be cured. Do not treat it as something which only you are suffering from. All of us as humans have bad breath if we are not cleaning our mouth. When we open our mouth in the mornings, if you have not brushed your teeth at night, you are going to have bad breath. So remember, practice your oral hygiene religiously. You have to take care of your oral cavity as good as you want to take care of your body. And remember, anything which is happening is a sign from body, and it's trying to tell you that what is it where we're going wrong, how can we stop it. It's a sign which tells you at the beginning so that we can stop something major from happening. So I hope this helped you, and please like this video if you like the content. Please share with your friends and family, and subscribe to our channel, hit the notification bell. And I upload video every Wednesdays, and these are oral and dental hygiene related videos. The whole purpose of eDentophasia is to work towards preventive dentistry, where I help you prevent coming to us, where I help you take care of your teeth and oral cavity so well that you do not end up having a problem around it, and to educate you around how can you do that and about various procedures. So stay tuned, stay safe, lots of love.